Healthier Fleetwood started pretty much exactly 2 years ago, when a whole bunch of Fleetwood residents came together with a lot of their healthcare professionals in the town to discuss how we can start to turn around the significant illness and quite low life expectancy within the town, because it was quite clear that despite the NHS doing everything it could, the outcomes for our residents were still poor. So it's basically listening to residents about what mattered to them and then empowering residents to take control of how we bring about change. And that's really the journey that Healthier Fleetwood is on and continues to be on. This is such an important change in how we care for people and care about people, because in disadvantaged communities like Fleetwood, their life expectancy is actually starting to go down. Recent research has shown that now, for the very first time since the Victorian era, people in disadvantaged communities are starting to die younger. Despite all of the advances within modern medicine, people are dying younger. So we have to have a different approach, and that approach is wellness. That approach is focusing on those things that keep me well, rather than the NHS perpetually focusing on managing illness. Measuring success is something I think that the NHS does really badly. Its measure of success is, can we reduce hospital admissions? Can we reduce the number of times people go to A&E? Can we reduce the number of doctors' attendances? And actually, I think we're counting the wrong things. I think we should be counting, are we making a difference to people's lives? And that involves individual residents telling their individual stories. And what we've heard today at the World Health Innovation Summit in Blackpool are 5 Fleetwood residents telling their own stories, telling their really inspirational stories, how they are taking control of their own lives and taking control of their own health. And that's 5 out of a multitude of stories that are now coming across in the town as more and more residents become part of a very resident-led movement. I certainly think that this is the way that a lot of communities now should be aligning themselves on the wellness agenda. Across Lancashire, we have lots of communities that are disadvantaged: central Blackpool, central Preston, parts of Blackburn, Skelmersdale, pretty much all over Lancashire there are disadvantaged communities with significantly poor health outcomes as a result. And we are seeing healthier communities coming along. I think there's now a programme called Healthier Skelmersdale, which is very, very similar in its design to Healthier Fleetwood. And I would love to see healthier towns and healthier communities right the way across this thing that we're now calling Healthier Lancashire. Yeah, social media is really interesting, because I think there's real power in storytelling, in people telling their stories about what's made a difference to their lives. And if it's made a difference to my life, then it can make a difference to your life. So however we get those stories out, the more they're seen and the more they're heard, the better. And what better place than social media? I think most folks now are aware of things like Facebook and Twitter and YouTube, and Healthy Fleetwood has its own website, and we encourage residents to look at that and contribute to that and put their stories on there. So yeah, absolutely, bring on the social media revolution, yeah. So and anybody can get in touch with Healthier Fleetwood through the Healthy Fleetwood website with the direct email address, which is listening@healthyfleetwood.co.uk, and getting in touch with me personally through WHIS, and the organisers have got my contact details and have got Healthy Fleetwood contact details. And the more we can capture people's stories, the more that we can put those stories out, then this social movement that we've got going becomes unstoppable. Through the website, we signpost people to a thing called Orca, which are the apps that are the most popular. So people can have a look at those apps. A lot of them are approved by the NHS. Apps around managing certain conditions, such as COPD. So there are a whole range of apps that we signpost people to. And we're looking at other ways of using digital technology, even getting into the realms of, say, video consultations between doctors and patients.